What's up, everyone? Welcome back to our new installment of the live. I'm Dr. Matt Westheimer, for those of you that don't know me. And today we are going to be talking about the missing link, and then in parentheses, S, the missing links to low back pain. And so I'm really excited to share. I'm actually not just going to share one missing link with you. I'm going to share a ton of stuff with you guys today. So I hope that you have a brand new pen out full of ink and a fresh notebook, because we're going to be giving you a lot of practical information. So the first thing I just want to share with you guys is the importance of this, and the importance of finding and fixing these missing links. Because these things, when it comes to low back pain, rarely does it come out of nowhere. Almost always is it a cumulative thing that builds up over time. And a great reminder of this for me was actually a recent patient that has come in, and he's been dealing with low back pain on and off for the last 30 years. Now, 25 years ago, he had surgery for a disc issue all the way down at L5-S1, so the lowest part of the low back. So if we look at this here, right around in this region, right here at the bottom, right there. And he had surgery down there. And for a while, it was feeling okay, but then it kept coming back. And then most recently, it came back with a vengeance. I mean, when he walked in the office, he could barely move. He could barely sit down. It took a couple of us helping him to get on and off the table. I mean, it was in really, really bad shape. So we took x-rays, and you could see that area that had the surgery 25 years ago, the disc was almost completely gone. I mean, there was very little space. You could barely see a differentiation between those two sections of the spine because of so much deterioration. And we have to think about how we're approaching just really healthcare in general. But a lot of this, when it comes to low back pain, is what we're doing is we do a really good job of treating the symptoms. And so you take enough medication, or with surgery, what it does is it gets rid of the symptoms. So if you have a discectomy where you remove the disc that's pressing on the nerve, then you'll get some relief down there from that. But the problem is if you never corrected the biomechanical issues or the neurobiomechanical issues that created that excess wear and tear in the first place, then what's going to happen is it's just going to keep deteriorating, and you're going to be left later on in a worse place than when you started. And so we have to correct the dysfunctional alignment and movement patterns. If not, we will absolutely pay for it later. And so when it comes to structural health, what we do, though, unfortunately, is we remove ourselves from reality. So people think that we can get away without optimizing our biomechanics and alignment because they don't have pain. So they think only when there's pain, then it should be addressed. But an example, I want to give you a couple of examples like that. Approaching it thinking that we don't have to address it just because there's no pain is very similar to not brushing your teeth and thinking that that's okay, then you won't have any problems because there's no pain. And if there's pain, then that means we need to brush our teeth. A lot of kids do that, right? They don't brush their teeth. And then, like myself, or I have family members that have had severe issues with their teeth and with their gums. Now they never miss an opportunity to brush, to floss, to do all those types of things because they understand the consequences of not taking care of that. Another example is it's very similar to if you don't study for a test, you think you're fine because you haven't failed the class yet. When the test arrives, if you haven't prepared, you will fail. Like, that's just a fact. And so when the test comes for your low back, meaning doing certain activities, behaviors, and things, if you have not prepared yourself for the test of life, you will pay the price, as I did many, many, many years ago. And so I want to go through with you really the kind of 6 missing links. So I love you guys. So I'm not just going to share one missing link with you. I'm going to share 6 missing links with you guys. And so the first missing link when it comes to optimizing your low back is hydration. And hydration can be categorized into 2 categories. So if you're note takers, this is where you want to start taking notes. So we have just hydration in general, meaning drinking enough water that has enough minerals in it. Because here's the thing, if you're drinking plain distilled water, your body will leach nutrients and you're not going to hydrate yourself the way that you should. You have to have electrolytes in your water and minerals in order for your body to absorb and use the water appropriately. If you're dehydrated, all your tissues are affected. Your discs are affected, your connective tissue is affected, your muscles are affected. Everything is affected by dehydration. So you want to make sure that you're hydrating with enough fluids. Now, the second part, part two of hydration, is a process known as imbibition. So for those of you that are PTs and movement people and doctors that are listening to this, imbibition is a process of pumping the disc and creating this negative pressure by pumping the disc that pushes fluid in and out of the disc, keeping it healthy. Very similarly to squeezing a sponge, where fluid will go out, and then when you release it, it draws fluid back in. And so that comes from normal movement. If you're not moving, you're compressing. When you're moving, you're hydrating the disc, unless you don't have piece number two. And that's optimal alignment, or what we like to call neurobiomechanical integrity. So if you do not have proper alignment and one of those joints or bones is shifted out of position, it's going to create a shearing stress on those discs. It's not going to articulate properly. So that shearing and compressive force is going to dehydrate the disc and not allow water and fluid to be drawn back in. So that will break down over time. The third component we need to look at is how you're moving. So if your mechanics are not appropriate, if your hip hinge is not where it should be, if you're not flexing and extending the way that you're supposed to, if your gait patterns are off, that is going to affect loading and create an abnormal wear and tear and an abnormal stress. We have our friends over at the Charlotte Running Company who have a treadmill that you'll walk or run on, and they actually do a slow motion video of your gait. And we have some people in this group. Just comment below if you want help with this. We have a lot of people in this group that can help you with that as well. Number four is activation. So activating the right muscles. There's a great doctor that I visited who's an orthopedist, but he specializes in movement and functional rehabilitation. And he's got a giant screen in his room with this clothing that you wear with sensors in it. And basically, a lot of what they're doing is teaching people how to activate the right muscles, how to turn on the right muscles. Most people, because of so much sitting and the lack of normal movement, one of their biggest stabilizers for their low back is a muscle called your glute medius. And a lot of people, their glutes are shut off. And if your glutes are shut off, it's impossible to create stability through your core and through your low back. So we got to make sure that we turn those muscles on. And if you're experiencing tightness in these muscles, most of the time when people think of tightness, they think of overactivation. Many, many, many times, tightness comes from weakness, from not activating the muscles. So we need to work on activating them more rather than just stretching them, which it's a losing battle. Number five is the fascia. So the fascia is actually quite interesting. So basically, every tissue in your body is covered by fascia. So your organs are covered by fascia, your muscles are covered by fascia, your tendons and ligaments are covered by fascia, your bone is covered by fascia. So every single piece of your body is covered by fascia. And the cool thing is that all of the fascia in your body is connected. So like when you wiggle your finger or you move your ankle, it's affecting your organs. Now, I know you're like, how can that be? Now, I'm not saying that it's directly affecting it. Like if you wiggle your finger, it causes your liver to produce more bile or something like that. No, that's ridiculous. But what I mean is that if there's tension in any fascia of the body, it creates restrictions that globally affect everywhere else in your entire body, and it disrupts the overall global communication system. And so we got to make sure that the fascia is working properly as well. And then number six is technique, right? Like not just learning how to move, but then when you're doing your exercises, when you're doing your movements, if your technique is off, you could have good activation, you could have your fascia be pretty good, you could be hydrated, but if you're deadlifting and you're creating massive flexion and extension faults, over time, it doesn't matter how healthy your tissues are now, it's going to cause an excess wear and tear and breakdown as time goes on. So this is why so many people suffer from low back pain, is because so few people actually take the time, energy, or even have the understanding, or even go to a practitioner that has the understanding of how to get to the root cause of the problem. And rarely is this a quick fix or a simple fix. A lot of the time there's multi-factors that are involved in this that we have to address if you really want to restore proper motion. Now, the best thing to do for those of you that have kids move, for the most part, they move very well early on. And it's just a matter of maintaining that. But the problem is that we learn so many dysfunctional patterns as we go through life. We don't look at starting to correct these things until we're suffering 30, 40, 50 years down the road. And then it makes it much harder to correct. So if you need an evaluation, if you'd like an evaluation, just reach out to us. We can do a complimentary case review for you guys. If you are a current patient watching this and you have some more questions, you can post them below or come in and ask during your visit. As you know, to Jen's dismay sometimes, I love questions. I love to answer questions. I love to help you guys. I love to support you guys. And I say to her dismay sometimes because it gets us backed up every once in a while because I just can't stop talking because I love to serve. But if we need to set up a special time to go through some of this stuff, I'm happy to do that for you because as you can see, it is quite complex. So thank you guys so much for tuning in today. I know that we're trying to keep these real concise so that way you can digest the information. But if you need me to unpack any of this in more detail, don't hesitate to reach out or comment below. I love you guys. I appreciate you guys. And thank you for the opportunity to serve. We will see you next week. Have a great one, everyone.